seems like the flu and pneumonia are running rampant right now. Chrissy and Danielle are here from Coventry Meadows, part of the American Senior Communities family, to tell us maybe how we can stay safe or what the symptoms are. Give us all the details. I was just telling you, I feel like this is a germ-ridden facility here. And the one thing I keep hearing people say, wash your hands. Mm-hmm. Wash your hands all the time, wash your hands, wash your hands. So tell us who is most at risk for getting pneumonia. Please tell me it's not me.
Well, I will tell you, the people who are 65 years or older are at the highest risk. They're 10 times more likely than other adults to be hospitalized over pneumonia, and it can be fatal. So, yeah.
So I'm not quite there yet, but I'm getting close to that group of people. So is there a vaccine specifically for pneumonia?
Absolutely, and the CDC recommends that everybody 65 years or older get that. And that's the Centers for Disease Control. And that really helps prevent a lot of strains of pneumonia. So they highly recommend it, and I do too. I'm a big vaccine
Chrissy says,
advocate.
get that vaccine. So is that different from the flu vaccine then?
Absolutely, and you should get the flu vaccine too, because what happens if you get the flu, you're more susceptible to get pneumonia after that, because your immune system is down.
And this is my ignorance. So 2 questions. Can you get them at the same time? And is it too late? Here we are in January now. Is it too late to get them now?
It is not too late to get them now. In fact, in the winter months and in early spring is when you're more likely to get pneumonia, although you can get it any time of year.
So how do I get pneumonia?
Well, it's transmitted through like mucus and sputum and stuff like that. So if you're around somebody who has it and they're coughing and they're not covering their mouth, you're highly susceptible to it, and you need to just wash your hands all the time because you can pick up bacteria,
anywhere.
Yes.
And you don't realize, I'm guessing. I'm thinking of all the places, especially when I was shopping for the holidays out, in the malls, in the stores, and all the people that were coughing and not covering their mouths, or they really did think they were, but when you are coughing into your elbow like this, that's not so much catching all that stuff that's coming out. So tell me what the symptoms are. You mentioned in the break, we were kind of chatting about it a little bit, and you said a lot of people think they have bronchitis, but it's really pneumonia. What are the symptoms of pneumonia?
Well, cough, fever with chills, you can it's constant fatigue. Also, you can have chest pain along with it. If I had a fever and I was coughing and chest pain, I'm going to the doctor, because most of pneumonia is bacterial and it can be treated with antibiotics only. That's how it goes away. So
it's not that you can't just wait this one out. It's not gonna.
Not unless it's viral, but the most common is bacterial. So, and there's lots of strains of that.
So tell me the difference, flu versus pneumonia. I mean, because is the flu always a stomach variety, or is the flu sometimes this respiratory thing too?
It can be respiratory, it can be congestion, So they're a lot alike, those kind of symptoms. Sometimes you can have a fever with flu or not, and with pneumonia or not.
Is there anything we can do if we get the flu? Is there anything to lessen the length of it? Anything is that one where you just gotta wait it out?
Well, there is a medicine if you go to the doctor right away. If you start on this medicine, and I forget the name of it, but it can nip it in the bud a little bit, shorten it, but not cure it.
But you're not gonna cure. And again, you like the vaccine.
Yes. Absolutely.
All about the vaccine. I want to talk a little bit about what you guys are doing at Coventry Meadows as far as helping your patients and what you guys are doing to make flu season more bearable for everybody. So we'll do that when we come back. Stick with us. We'll be right back.